Hello, everyone. Today, we are going to talk about how to make a dorsal vein constrictor. It is a purely practical session. This video is mainly for medical and some dental professionals. However, if you are a medical practitioner, I strongly recommend you to contact your local dental technician or dentist to get some practical advice. Before we start, we have to be familiar with the workflow of making a constrictor. Firstly, you have to take an impression. Then, you make a working model or die out of impression. After that, you make a constrictor on the working model or die. Finally, you fit that into the patient and adjust it. These are the basic overview of workflow. But you probably will carry out the first and the last part of work in clinic. The second and third will be done in the lab. Let's talk about taking impression. I personally found this part most difficult in making a constrictor. However, once you overcome this hurdle, the following parts are relatively simple. Impression can be taken by you, or patient himself, or his partner. If possible, it is best for you to take an impression for patient, while penis is fully erected. Some patients find it difficult to maintain erection while taking impression. If you come across this difficulty, I strongly recommend you to use some sort of aid, such as Viagra pill, mechanical suction pump, visual or tactile stimulation, anything etc. However, most of patients want to take impression by themselves, in their private space. That is very understandable, but you have to instruct patient clearly and carefully how to take impression. Otherwise, you won't get good impression, and you will waste impression material, which can be costly. They usually fail in their first couple of attempts. Therefore, you have to dispense enough amount of material. But if patient's partner helped to take an impression, it was found that a good quality impression was taken at the first or second attempt. Therefore, it is important to educate the patient and patient's partner together, if possible. To take an impression, you have to prepare some impression material. As long as you can find any suitable material, you can use it for impression. However, I suggest a couple of suitable materials to you. I recommend vinyl polysiloxane putty, so-called silicone putty, and alginate. I personally like to use vinyl polysiloxane putty, since it is easy to handle and it is not messy. Alginate is one of the most commonly used impression material, and this material is cheap and readily available. However, you need some sort of rigid cylindrical shape impression mold to hold mixed alginate wrapping around penis. Also, it is a bit messy to clean up because it tends to stick to pubic hair. There are so many materials available, but the best material is the one you feel most comfortable to handle with. Now, I will show you actual impression taking. We will start with silicone putty. I like this material. It is accurate and easy to handle but slightly costly. Before you take an impression, prepare a paper cup. Cut off the bottom 1/3 or half of it and fit that into penis. Make sure that the wider opening of paper cup goes towards the distal end, that is, the tip of penis. And check the cup around penis, so that it fits loosely to accommodate enough and even thickness of putty around it. It is always a good idea to read the manufacturer's instruction before you use impression putty. Now let's take an impression. Mix putties together quickly but thoroughly until you get homogeneous mix without showing any streaks for 30 seconds. Place the paper cup around penis and pack the putty all around evenly. Make sure that narrow opening of cup is touching the pelvis. Once you pack the material inside the cup, stay still and wait for 2 minutes for its initial setting. Erection should be maintained during this critical initial setting period. After another 2 minutes, remove the impression from penis and check the impression. Check the dorsoproximal part of impression, which should be nicely curved, showing the round joining area of pelvis. and proximal part of penis. Check ventroproximal part, which is showing the protruding urethra. Check overall shape of the impression. We want a nice ring-shaped impression. At least 5 mm of proximodistal width of impression is needed to make a constrictor. The more you have along the length, the easier the constrictor making is. You will be very surprised how individually different the impression is from each other. Let's move to alginate. Now, I will show you the alginate impression taking. You need a rigid mold. I constructed a vertically heaved mold which has 5 cm diameter to fit a penis with approximate diameter of 4 cm. Make sure that the mold has vents so that alginate can be squeezed out while taking an impression. Let's take an impression. Mix the alginate with proper amount of water. Again, check the manufacturer's instruction. The mix should be nice and creamy, and load the mixed alginate in each heaved mold and wrap those two around the penis and secure it for a minute or 2. Alginate sets faster than silicone putty. Done. It is a bit messy but cheap and quick. Again, check the anatomical structures from the impression. Once you have the impression, you send that, as a whole, to prosthetic labs for constrictor fabrication. There are so many ways of making a constrictor, and prosthetic lab will decide their own way. One thing for sure is that it is very simple job for them, because it is a small piece, and does not require high degree of accuracy. The constrictor is supposed to be fitted around proximal end of penis. So, lab technicians have to design the constrictor accordingly. The basic principle of design is very simple. The upper internal surface of constrictor is thickened by a couple or 3 mm to put pressure on dorsal veins, and the lower internal surface is thickened slightly by a couple of millimeters to engage elastic urethra for retention. I recommend orientation depression or protrusion at the left upper lateral corner of constrictor. How simple the design is. The detail of laboratory process and design will be discussed in next Q&A session. Now, let's say you received a constrictor from a lab. You issue the constrictor to patient and give them a usual instruction which is same as the cock ring or erectile dysfunction ring. Make sure that you show them how to orientate the constrictor in right direction. If it is not fit correctly, it will cause pain and discomfort. For adjustment, you need a handpiece with handpiece motor and acrylic burrs. Also, you need cold cure acrylic resin for addition. You can buy them through internet, such as eBay or Amazon. Otherwise, you can contact your local dental supplier. When patient feels too tight, just trim upper and lower internal surface by 0.5 or 1 mm only. If you trim too much, the constrictor becomes less effective. If they said it is too loose, then you add cold cure acrylic resin on the upper and lower interior surface by 0.5 or 1 mm only. Trimming is easy, but I will show you how to use cold cure resin. You can buy different types of cold cure resin, but I recommend the one for temporary crown or denture repair, because their handling property is good and sets fast. Just mix very small amount of liquid monomer with polymer powder, and you will get creamy mix, and you add a small amount on the surface you want with brush or mixing spatula. After a few minutes, it will be hard enough for trimming and polishing. Basically, you are repeating trimming or adding in a shoeing session and follow-up session. Again, more detailed adjustment will be discussed in Q&A session. So far, I have shown you only very basic practical techniques you need in clinic. There are so many different practical techniques. It is all matter of how you develop it. We will discuss more of technical aspects, and we will have a Q&A session in next episode. If you have any question, please feel free to leave it on YouTube. I will try my best to answer your questions in next episode. Thank you for your attention and have a fun.